Let's go to Michael Cannon. He is the Director of Health Policy Studies at the Cato Institute, and he's with us here. How are you, sir?
Good to see you, Glenn.
Good to see you. I want to show this chart. Can you bring up the chart, please? Show this chart, and whew, this is how simple this is going to be. This is the new schematic of the health care plan. Where are we?
This was put together by some Republican staffers on the Hill after reading the House bill.
Okay.
Consumers, you'll see, are all the way over here.
Okay, this is us. This is, and I've got a nasty cough.
Their doctors, healthcare providers are all the way over here.
And somehow or another, I have to
what
find
you see in the flyover states.
Right. I have to make it through this maze to see the doctor.
Yes.
Okay. There's a couple of things on here that I don't recognize as part of my health care. Here, this is the Office of Civil Rights.
You've got an Office of Civil Rights, an Office of Minority Health. You've got all sorts of offices in here that have to be created every time you create a
Wait, this is the Office of Minority?
Yes.
Wait, hang on just a second. Are minorities not part of the universal human thing, or do they get different sicknesses?
This is what happens. This is what happens when government runs the show. You get a different little office for everybody.
Okay, so we have Office of Civil Rights, the Office of Minority Health, which I'm confused by just a little bit. Then you also have the Health Advisory Committee. I think you have this is the Workforce Corporation or something. What the hell is this? The Workforce Corps. What is that? The health workforce?
Glenn, I have no idea what that is. This is a 1,000-page bill. They just dropped it. They're going to start voting on it on Thursday, and they want to ram it through Congress before anyone has any idea what most of these things are going to do.
Yeah.
Particularly this guy right here, the Health Choices Administration. When the government creates a bureaucracy called the Health Choices Administration, you can guarantee that it's not going to expand the choices that are available to you. It's going to be reducing those choices.
Okay.
And it's going to be.
So what kind of choices? Is this like Healthy Choice?
Well, it's
like
all
this frozen meal or this frozen meal.
This is going to be the government bureaucracy that decides what kind of health insurance you have to buy. So about half of the most economical policies on the market are going to be eliminated by this agency right here.
Okay. And then the Bureau of Health Information, is this new?
I think that one is new.
You don't need. We've had a day.
It's 1,000 pages. I'm just not a speed reader.
Right. Well, this is fantastic. As everybody was watching Sotomayor, may I make a suggestion? I have my own chart. Let me. Now I know this is a little complex. I'm a deep thinker, but I just want you to look at this chart. Okay, this is an idea. Okay, over here we have me. Okay. And then way over here, we have the doctor. And in between, we have me walking to him. What do you think?
I think that's fine. I think I'd draw a bunch of dollar signs over by you to make sure, or maybe even the government and an employer here, and an arrow showing the money going to you and being taken away from them, just to make sure.
Wait. Okay, so here's my employer, okay, and he's giving me money. And then I give my money to the doctor when he treats me.
The problem with your chart is this. This is how much Glenn controls right now, or how much consumers control right now. And this is how much the government controls of all of our health care dollars, and this is how much employers control. And that's the problem right there. So what we need to do is we need to take all of this money and give that to Glenn. Let him choose his health plan.
Wow, that would be good.
That is not what this chart back here is going to do.
Okay, look, here's the thing. In all seriousness, the problem is you have, with anything that we have right now, we have all of these layers in between. We don't have, when's the last time you went to a doctor? And I don't know if this has happened to anybody else, but the doctor has said to me, are you covered, or do you have insurance? Yeah. Okay. Why? Well, I got a cheaper drug that I could. Nobody cares, because we are so far removed. The employer pays for it. The government pays for it. Insurance pays for it. We don't care. We're out of the loop. I don't care. And the doctor, he's got so many lawyers over here suing him that he's got to run every test. Otherwise, you'll sue him.
And as long as 300 million Americans don't care about the cost because someone else is paying for their health care, we're never going to get cost control. So all of this nonsense about all these bureaucracies and how they're going to find efficiencies in the system, it's garbage, because we're not going to get that if the patients aren't on our side.
Hang on just a second. I forgot one thing. This is the majority Rights Administration, and they just stay in that box and they're not connected to me at all. Thank you very much.
Thanks, Glenn.
Appreciate it. All right.